Starting, all attendees are in listen-only mode.
Hi, good afternoon. Today is June 25th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, and we have Robert White, Director of Fiscal and Operations, Nick Burton, CMRO Regional Director, and Ron Peel, Budget Director. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. If you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There is a handout for the webinar, and you can find it in the handout section in the panel to your right, and they can also be emailed upon request. We will be recording the webinar and posting it on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Bernie Simons. Good afternoon.
Good afternoon. Good afternoon. Can you hear me okay, Donna?
Yes, you sound great.
Okay, good. Well, I want to thank everybody who's on the call. So obviously we should be on the agenda item with the opening remarks, etc. So again, good afternoon, and I want to thank everybody for all of the continued support in attending these webinars. I know we started out weekly, and then we did every other week after about almost a year, and now we're in monthly, as we're one of the 3 states that are in the green zone with COVID. And I want to just thank everybody that you know, as we're here to listen, and as public servants to make sure that we're moving the system forward and being responsive to everybody with intellectual and developmental disabilities, their families, providers, direct care staff, everybody. I mean, we're all in this. You know, I think we've done, you know, in basically a lot of providers an outstanding job in having people vaccinated, etc. So today we're going to talk about the governor's executive orders. We're going to talk about the Secretary's orders, the Maryland Department of Health orders. We've got some vaccination opportunities for families and people who are participants in our services. I want to talk a little bit about the CMS guidance on the American Rescue Plan funding for Medicaid, home and community-based services. We'll talk about the national core indicators. We will also talk about DDA and individual family reopening surveys and some of those results, that what we hear from everybody as we move forward. And then, as we've been doing since the beginning of the pandemic, I will share our COVID numbers. Next slide. So our highest priority, again, is health and safety and well-being of everybody. Families, staff, individuals and supports, providers, people who are self-directing, everyone. I mean, we are in this together, and I'm committed to be transparent with all of our stakeholders, and we will continue to work with information and share information and ask for feedback, and how do we provide for the best service opportunities for people, so that people can have a good life, a fulfilled life, and live out their dreams, etc. So again, I want to thank everybody for all your support that you've done. I think these webinars have been a good way to stay in touch, to be able to get some good questions that we could respond to and work collaboratively together. And again, you know, I think even though I mentioned that we're in a green zone, I still think that we know that some people out there are still hesitant about being vaccinated, etc. But I would just ask people to continue to practice good hygiene with hand washing, and, you know, follow the proper protocols within your county if they haven't reopened, or wherever they are within the county. You know, as the governor has said multiple times, he issues statewide, but the counties can be more restrictive. They can't be more liberal than what the governor's issued in orders, but obviously they can be more restrictive. Next slide. So Governor Hogan is lifting all capacity restrictions on outdoor entertainment, art, sports, indoor entertainment venues, etc., and dining, and a lot of that started on May 15th at I believe it was 12:01 in the morning, and he announced that the indoor mask mandate will soon be lifted, and we know we're moving forward with this. Again, there's a link here for the governor's orders and what he's done, and our case rates have dropped, and again, we in Vermont and South Dakota are the three best states in the country, so we need to continue to be vigilant and not relax, especially when we hear about these new strains of COVID coming. People thinking that if you're vaccinated, that's good, but and it is great, especially if you've had Johnson & Johnson with the one vac, or Moderna and Pfizer with the two vaccinations. So we continue to make great strides, and you'll see that later slide about what our percentages look like. And so obviously now we're in a phase looking at vaccinations that have been approved for the FDA and the CDC for Marylanders ages 12 to 15, and where we are with that, and again being able to move forward and making sure that everything is as good as it is as we move forward. And again, vaccinations is the covidvax.maryland.gov. So we've talked about that site before, about finding out where you can get vaccinated, etc. So next slide. So on June 20th, Maryland reported 0 new cases of COVID for deaths for the first time since October. I think that's a major milestone, knowing that the number of people that we had lost due to this disease and this pandemic. But it is a milestone. It's showing that we are moving forward. And, today's metrics will clearly show where we are as a DD, and, who's been reporting to us from the provider and families, etc. Again, if you haven't been vaccinated, I do encourage you, as I said, we were on the last slide, to go to covidvax.maryland.gov to find out where you can get vaccinated, and we can, again, continue to jointly move forward and have everybody stay safe in our DD community. Next slide. So the governor's orders, and there are links here, so you can link when you get these. So the governor's order of number 2106-1501, and then the other one below that, you'll see about the suspension of certain legal time limits. So again, this is around face coverings, etc. All occupancy restrictions, eliminated indoor and outdoor. The cruise terminal closure order is terminated, which means that they will be open again. The order delegating authority to local health departments is terminated, and the governor amended orders enabling alternative alcohol services effective immediately, outdoor table sizes, etc. So, again, I'm not going to go through this. I mean, many of you watch the news, listen to the governor's press conferences that are very detailed in discussion about him giving an update on where we are with the COVID and the vaccines, and having our Deputy Secretary and for Public Health, Dr. Chan, and Secretary Dennis Schrader available for many of these press conferences that he's been doing. So, again, these are references for you to go back and take a look at if you did not have an opportunity to listen and participate in the governor's press conferences and the updates of where we are with the state and COVID. Next slide. So number 3 in the governor's order is note that he is delaying the expiration of nursing licenses until August 15th, as you see. The previous order was earlier than that, so we can go to the next slide. Okay, so as I mentioned, we're talking the governor's orders, and then we've got secretary's orders, Secretary Schrader. And so in addition to that, we've got these, of which the directive and the order regulating certain businesses and facilities, as it says up here in blue, as you can see, June 15th. And then it basically said was when it was issued. And then you can see that effective July 1, MDH orders will terminate, including the order of pertaining to face coverings, because you get the governor's order, executive order, and then you get the secretary's order for health. And then you'll see on effective on August 15th, all existing COVID-19 department, the Maryland Department of Health orders, guidance, and documents and bulletins will cease. They will be terminated. And that's the second bullet that you see on there. And then effective the 31st of December, the end of the calendar year, certain orders will terminate, including the healthcare matters, nursing home matters order, vaccine matters, etc. So again, we tried to do a comprehensive look at the orders, again, from the governor and from the secretary, as we wanted to share on this webinar this week. So we continue with the amended orders. You can see that when there's a vaccine that is administered, that it's reported within 24 hours to the department, and that we continue to have provisions to the local health departments to order quarantines, etc., and isolations. And again, there are links to where this is in blue, where it says number 2 and number 3, and extend certain patient transfer items. So again, this is just a recap of where we are as a state. And then we get to number 4, and obviously this is adds provision that skilled nursing facilities register in Immunet, and that's the IT platform that basically has people who have been vaccinated in there, and it acts as a registry. And so, obviously we want to continue knowing that initially when the pandemic started, that there were nationally a lot of skilled nursing facilities that basically had a high rate of COVID, people who tested positive and became seriously ill and even passed away. So, again, it's a congregate setting. We know that at times there was people who were addressing some of the issues around the pandemic were familiar with nursing homes, and many nursing homes can be large and have 80, 90, 100 people in them or whatever. And we had to do education, and I want to thank everybody who's on the call today, whether they be providers, families, my state staff and DDA, working with the local health departments, and having discussion about what a quote-unquote group home looks like, that it's really not a nursing home. And but we needed to be up in the first order, and we were get our folks vaccinated, etc. So next slide, I'm going to turn this over to Nick.
Everybody, happy Friday. I just wanted to give you guys kind of an update on the vaccine efforts. As you all know, there's been a tremendous effort in every single region to get individuals, people, families, staff, everybody and anybody vaccinated. And I think the last time I checked the data on that, I think within the DDA, we're at about a 75% success rate in getting people vaccinated. So thank you to everybody who has been a part of that. And thank you to I think the diligency that everyone's had around the vaccine and getting that out to people. I know that now we're kind of at a place where we're finding the hard to reach people. And so in an effort to support that, to support access to some of those hard to reach people that may be living at home and can't leave, or that may have not had access to some of the clinics in the past, we did work with SDAN and the Self-Directed Advocacy Network and with Alpha Pharmacy to get a vaccine clinic set up through them that is going to allow people in self-direction, their employees and their families, to be able to sign up and get a vaccine through Alpha Pharmacy. Alpha Pharmacy is also going to monitor and see who may need help at their home getting the vaccine. And so there's a registration link that should be going out today, and it will be sent out via the FMS. It's also going to be on our website or on our Facebook page, and we'll also send it out via our constant contact. We've also sent it out with an infographic, some video links, and some attachments just to help answer any question, particularly if there's hesitancy. And then Alpha Pharmacy has been fantastic throughout this process and is also making themselves available to ask about any questions if people have any sort of anxieties around the vaccine, particularly as it relates to any of their particular health conditions. So I think this is really cool. I think we're going to continue within the regions to make sure that we can access the people that need a vaccine and that just haven't been able to get to one. But again, I think great work, everybody. This has been such a tremendous effort. And it's so nice to see so many people starting to be able to kind of get back into their daily routine. It just makes me really happy, and I know that I think it makes all of us really happy to see that. So thank you.
Good afternoon. I just wanted to use the next few slides to provide a few fiscal updates for everyone. As you all know, we are coming upon the almost the end of fiscal year 2021. A couple of points of note here is that the error updates for May, attendance and certification for June are due into your regional office by July 9th, 2021. That said, providers can still submit 21 adjustments until August the 31st, of course, so that they could be processed in the Q2 or 2Q quarterly payment. Next slide, please. In terms of year-end reconciliations, for the FY 2020 cost reports, DDA will start issuing notices of non-submission as of June 30, 2021. As you all are aware, we have sort of extended the due date for the FY 20 cost reports in light of the situation, the unusual situation we were in with the the public health emergency. So to keep this rolling forward, we need to get back on track. So, we will start sending out those notifications as of June 30, 2021, if we have not yet received your 2020 cost report by that time. In addition, there are a few FY 2019 cost reports that we have not received and we will also be notifying providers about those as well. And this only pertains to providers who have not submitted FY19 cost reports. Next slide, please. So in terms of FY 2022 execution, FY 22 is right around the corner. The Q1 FY 22 payment is in process. The payment will be effective July the 6th, 2021, because I believe that Monday is a holiday. So the payments will be effective the next day, which is July the 6th, 2021. This payment will include the 4% COLA in the earned payment detail for the Q1 payment. In addition, we will be sending out notification to providers regarding the recruitment of the personal supports advancements. I think we did some notification in probably the Q4 FY21 payment, regarding personal supports and the whole issue with the transition of personal supports to LTSS and what that impact was going to be on the last, or the Q4 payment, I should say. But this will just be an additional notification just to make providers aware that we will be following up on this during the course of FY 2022, and we will follow up with some more detailed guidance about how we will execute the recruitment of those personal supports advances. Next slide, please. Just wanted a couple of points about retainer days. DDA has had a chance to have some follow-up discussion with CMS, and a couple of points of emphasis here, because I know there was still questions surrounding the revenue and what constitutes total revenue and what providers should be looking at. But a couple of points here is to really adjust or compensate for revenue loss in day programs. That's the whole point or intent behind the guardrails and the guidance that CMS has provided. And in terms of total revenue, that essentially means revenue that is used towards home and community-based services that are offered to our participants. Next slide, please. So another point we wanted to emphasize is take an opportunity to just talk briefly about the American Rescue Plan funding. This is a program that was passed and approved by President Biden, and it's basically for states to implement the implementation of Section 9817 of the American Rescue Plan, as well as to describe opportunities for states to do several things, which include to strengthen their home and community-based services, systems, and response to COVID-19 public health emergency, to also assist in increasing access to home and community-based services for Medicaid beneficiaries, to adequately protect the home and community-based services workforce, to safeguard financial stability for home and community-based service providers, and lastly, to accelerate long-term services and supports reform.
Thanks, Ron.
Please.
This is Robert White, the Director of Operations and Fiscal. And for those of you who didn't recognize Ron's voice, that was Ronald Peel, the Director of Finance, who was presenting on the error updates, et cetera. So thank you, Ron.
Okay.
Okay, so Can everyone hear me?
Yep.
Okay.
Okay, great. Okay, thank you. Next slide, please. So I know that many of you are anxious to know where we are as a state with the enhanced FMAP. We have been working with our Medicaid partners and others regarding the guidance that CMS gave to states a few weeks ago. And we've asked CMS for some additional guidance. We also requested an extension of the deadline to July 4th, just to give us time to consider, you know, the additional guidance that we requested from CMS in order to get our spending plans in. Most of you have already know that most states did request that same extension, because CMS really gave us a shortened timeline to work on this. What I can share with you today, though, at this point is that, as you may or may not know, the Maryland legislature has mandated that at least 75% of any enhanced match that we receive be used for a one-time rate increase that is retroactive to the first 2 quarters of FY 2020. They also directed that we establish grants to community providers and other not-for-profit organizations. Next slide, please. And so with that said, the DDA is interested in hearing from you all and what your recommendations are for how you think we should, you know, use some of the enhanced FMAP to fund and or support service delivery, as well as some ideas around the grant. So if you have recommendations or suggestions, please send them to the email address that you see on the slide before you. Next slide, please. Okay, so we're very excited to announce that we will be moving our first group of early adopters as part of the expanded pilot into LTSS, and they will be going live on July 1st, so next Thursday. They've also, along the way, been documenting, you know, their preparation processes and in the hopes that we'll be able to develop a playbook to assist in any future efforts. We're also excited to report that we're working and are very close to completing a comprehensive LTSS troubleshooting guide. And this guide will serve as a companion guide for providers and case management agencies to assist in answering questions, as well as resolving inquiries that may arise, and provide solutions that will hopefully avoid the need to create a help desk ticket or even save a phone call to the regional offices, because you'll be able to hopefully find solutions that are available at your fingertips. The guide will also include details around various parts of the system with a focus on the PCP process. And now I'm going to turn it back over to Bernie.
Okay, great. So as I mentioned early on, part of the topics that we were going to talk about is now we're on to the national core indicators. And I want to make sure that it's clear to everybody that these surveys really help DDA learn about family experiences and, you know, how to improve the quality of services for individuals in our supports and their families. We did have a good opportunity to learn through the pandemic about people who really enjoyed the opportunity of doing remote services that if we didn't have the pandemic, they may or may not would have experienced. And we know that. And again, we want to hear back from families. It is anonymous. It is voluntary. It's your choice to participate. You know, you don't put your name on the survey or anything. So no personal information is collected, etc. And so surveys were mailed a couple of weeks ago. And in order to respond to the survey, there's 2 options. One is going in and actually completing the survey online, or the other one is completing the paper survey and mailing it back to DDA. There should have been a self-addressed envelope in there. And we've included the links and all of the information that we have, including contacting one of our new staff, Nicole, who is going to be over quality enhancement, and the National Core indicators basically fall under her purview. And so if you've got challenges in completing the online survey or anything, please reach out to Nicole, and you can see that her email address is basically there. Next slide. So, I think that, the NCI staff stability is another area that we want to take a look at. Again, this is basically to help strengthen our system. And what do we look like? I mean, we keep hearing now that, and we've seen reports that were done within the past few years, one by Anchor, one by the President's Commission, about the workforce shortages, et cetera. We know that we've heard now from some of the providers that people who did not work during the pandemic have had other opportunities to work and are not going back to their agencies, and there can be some issues. So, when you start looking at staff stability and all of this, I mean, we need to really do well so that we know where is Maryland as a state in looking at that. And, each state has been tasked with trying to get 100% of the providers to participate. And, your agency, should have received a direct email from Human Service Research Institute and, inviting you to participate in this. And in the email, you find a unique logon for you and where you are, and you're going to be reporting back into the database. And, again, it's anonymous, and, there isn't any issues, but it gives us an opportunity in the state to take a look at what does our workforce in the world of DDA look like, and what's the turnover rate, and what are the vacancy rates, and what's the pay rate, and many, many things on there. So, in order to get your agency to be compliant with the wage survey that we did in 2020, it's my expectation that providers will respond to the staff stability. That is part of the NCI no later than June. No later than July. And again, if you have any questions about that, you can reach out to Patricia and where we are with that. Next slide. So I think you're one more slide. There you go. So I just want to go back and give you some data. I mean, we track all of this stuff, and this basically shows that we've got 229 providers, and that how many links have not been clicked, how many have clicked the link, how many have completed at least one question, and how many have done the whole survey. And I know people are busy, and I know that people are concerned about trying to find staff and meet the needs of the people that you're providing support to. But this is very important, and I'd ask you to really start taking a look at this, especially for the people who have the link. You haven't even clicked on it and looked at it. I mean, I can understand if you opened it and looked at it and said, oh, I can't get to all these questions right now, or at least the 52 who have answered some of the questions. But again, I'm asking you that we obviously have a margin of error of 5.81%, and we want to be below 5%, which means that our confidence level would be 95%, and our margin of error would only be 5%. So, we need to really think about this to help not only DDA and what we're doing with this, but how to use this data and this material that we're collecting statewide collectively in the future. Next slide. So many of you have participated also in the employment information. This will be our 7th year that we collect this information. It's all related around Meaningful Day. We're asking that you complete this by July 2nd, which is not that far away. And, you know, I know that you've gotten information and you've gotten access, username, password, and if you get some problems, you can see the contact person, John Shepard, on here at Institute for Community Inclusion at UMass Boston, and recognize that they are a University Center of Excellence designated by the DD Act. They are one of 68 in the country, and they are also designated as a project of national significance around employment, like Minnesota is around residential services when we see the reports that come out from them. And so, you know, this is real important to us. It's real important to the State Employment Leadership Network. I want to go back and thank a lot of providers who did work back a few years ago when we had Karen Lee as leading our employment initiative for DDA, and what we were working, what we accomplished, and what you collectively put together around employment, Meaningful Day, etc. So again, congratulations, but you know, let's continue with the journey that we're on and continue to make sure that we are dotting the I's and crossing the T's. Okay, next slide. So this gets to, and you may recall that we conducted 2 individual and family surveys on reopening, and you know, what would that look like? The first one we did in the fall, obviously, as it says, of 2020, and the second one we did in the spring of 21. You can see how many responses that we received. And again, you know, the whole purpose of the survey was to understand people's interest, comfort level of getting back to things as they were before COVID-19, and to guide and support what reopening and planning times look like. We did learn a lot about the interests and views of people who participated in these, and how does this information compare to reopening discussions, and you know, last fall versus now. We've had these discussions right along with not knowing when the numbers were going to go down, and what the governor's orders were going to do, and what information we got from the CDC, and the opportunity we had to have Dr. Fetter on many of our webinars. So again, we will use these to look at reopening, readiness, preferences. I mean, it's one thing to ask the provider community, and I know that the regional directors have been meeting within their regions with many of the providers and discussing reopenings, et cetera. And you may recall on one of our last webinars, we had a provider present that they really never closed. And so, and what did they do, and how did they get ready for that? We also know that there were many family members who said, no, I want to keep my son, daughter, brother, sister at home, and not have them exposed to any type of COVID. And no, I don't want anybody coming into my house. So, you know, we've got from one end of the spectrum to the other. And we know that we have to deal with people's preferences as we move forward. And so we want to understand all of that. We want to make sure that when we do continue to have discussions about reopening, and I know that I'm sure many of the executive directors of the provider agencies, whether they're doing day in residential or just day, having those conversations with the families and individuals who selected them to be their service provider. So again, you know, we've got 86 and 62%, et cetera. I think that one of the areas that we need to make sure that we are looking at with this is, what are people really telling us, and knowing also with some of this data that as an example, when you look at 12% of the individual versus 28 responses from individuals, I can't tell you if that 12% is really within that 28% or what percentage is. I don't know if that's 10%. I don't know if that's 12% that is within that 28. So we are looking at that data, trying to be very careful with what we're doing. Next slide. So obviously we were looking at where do you live, and with looking at some of these responses, and do you live at home or live with family, own home, or other. Again, these responses were collected from over, as you see, the total response is 565. Obviously, the majority, 52%, are living with families. And then we've got own home and living it with other people with disabilities, just about even 24 to 20%. And so, again, that's going to tell us how are we, as I mentioned on the earlier slide, and how does that relate to national core indicators, and how does that relate to the surveys that we do with families to tell us about reopening and their experiences. Thank you. Next slide. So, what did you do during the day before COVID? Obviously, we had the 500 responses, 523, as you see. And prior to COVID, where were people? And 22% were in community-based day services, and 23% and participants, and 12% worked, and I'm sorry, 23% worked, and 12% stayed at home, etc. So you can see where we are with all of this, and the 40% that participated in facility-based day services also versus community-based. Let's make that distinction. Right, facility-based versus community-based. We know that we need to continue moving forward, especially as we come out of the pandemic, and look at our service delivery model and what we've learned from individuals and their insights and advice and suggestions to the DDA about how we continue to implement waiver services, etc. And knowing that we still have the community setting to it that we need to come in compliance with. Many of you recall that federal law from CMS was basically started in March 17th of 2014. We gave states 5 years to come into compliance with not basically having facility-based services, but community-based services and being integrated into the community. And obviously that was a heavy lift. I think Maryland was positioned better than other states who had a lot of dependence on sheltered workshops. And so that was more of a challenge in those states. I think our providers and families and individuals stepped up. Obviously, our numbers keep going up. And we see that back on the survey that people are completing with how many people are basically have jobs and how much money they make on that survey that we've talked about for the Institute of Community Services at the UMass Boston. So, I think everybody's done an outstanding job, but, we still need to think about with reopening, what does that look like? And what does the local community look like? And what do local jobs look like for people, et cetera? So, again, I think we need to collectively think about this and be reflective and plan accordingly. Next slide. So this is about vaccinations and where we are. And obviously, I think that overall, we've got about 85% of everybody vaccinated, which is absolutely amazing. And that is, a lot of diligence that was done by individuals, families, providers who are holding clinics. And we're at 85%. And remember that, when we hear what's the statewide average, that it's like 73, 74%. So the DDA community is really doing well with getting people vaccinated and continuing to move forward with that. Now, again, this is only 604 total responses, but I think that gives us an opportunity to really understand how we are staying on top of that. There's a breakout that you'll see with East being the lowest, and I say that tongue in cheek because it's 81%. And that's just outstanding. To looking at the South being 87%, and again, I want to applaud some of the providers who had clinics early on, like down in Prince George's County and Southern Maryland, et cetera, as well as the providers all around the state. We know that there were early clinics held by the providers in the West region, in the East and Central, and again, I think everybody's done an outstanding job with vaccinations, getting people vaccinated, holding clinics, et cetera. So, again, I think this is outstanding. So let's talk about a little bit about what is your interest in reopening, and we'll talk about this about what are the current employment situations and plans for reopening that people have. Next slide. Next slide. Thank you. Okay, so in looking at this, obviously, we're looking at, are you comfortable with returning to a facility-based day services? And, we've got in the fall what it looked like, and now we've got 78% who are basically saying yes. And, I don't know if that's a relationship to where we are with the vaccinations, us being in a green zone, et cetera. But obviously there is some comfort by people who would say, are you comfortable returning? Yeah, I am. It could be that people are just tired of being at home. I mean, it could be multiple reasons that we don't know, and there could be many reasons that we do know on why people feel the way they feel and what they need to do. And I mean, this obviously demonstrates a desire for people to get out and to take a look at where they are. And again, I want to continue to engage with people to make sure that we have the appropriate service delivery system. Again, I mean, we had the opportunity to open slowly now, to be methodical about it, to be reflective of our services, to listen to everybody, and to do a design that meets individual needs and outcomes for our participants and our waivers, et cetera. I think we need to continue to do that. We got to pivot on a dime in March of 2020. And, we didn't have the luxury of, oh, we're going to close slowly. It didn't happen. There was a pandemic. There was an emergency that the governor declared. There was a federal emergency that was declared, et cetera. So, as we reopen again, I think we need to think about, so where are we with remote supports and all kinds of other things and opportunities that we had, again, the opportunity to learn during the pandemic. And now where we are is we continue to move forward and seeing how we're going to meet everybody's needs and listen to folks and be responsive, and the DDA be responsive. Next slide. So here we are. Are you comfortable with doing things that you did before the pandemic? And obviously, 73% of the people are saying yes. Now, this obviously is taking a look at where we are, because there was only about 73% who feel comfortable, while 15 don't, and 12 aren't sure yet. And I understand that, not being sure. I mean, there's a lot of people who still aren't sure, about what to do, what to go out. And there's, the restrictions are relaxed and changed about where we are and what does that look like being in public areas, et cetera. But we do know that people really want to talk to their friends and be engaged with them, et cetera. Next slide. So I thought that this was really interesting. Of the 337 who responded, that, when would you like to return? And 64% said immediately. You know, obviously versus the 8% once I'm vaccinated, or 7% unsure, or when the public health emergency ends. So we've got a spectrum here, but we do have a high number to indicate that, hey, I'm ready. I'm ready to go back. I'm ready to go back with my provider. I'm ready to continue to engage and do things a little bit differently as I self-direct my services, et cetera. And, you know, and we continue to do that and work with people. And hopefully, I think as we listen to people and engage with people, continue to move forward. Next slide. Well, you can see on this, as we asked, you know, if you had employment, what does it look like? And, you know, you can see that we had a lower response here at 162. But you can also see that about 21% of the people experienced job loss up on the left-hand side, the blue. And about 91% who lost the employment basically said that they want to go back and work. So that's a good thing. And again, as I mentioned earlier, on the settings rule, et cetera, but not just for the settings rules, the independence people can have about employment, self-satisfaction, the ability to get a paycheck and buy things that you want, et cetera. The things that, you know, everybody does, that we want to make sure that those opportunities are available for all our people in DDA. So again, I want to continue to do this, to monitor and how we're doing moving forward. Additionally, there was 79% of the individuals who didn't experience job loss, which I thought was interesting. Now, again, this is only 162 is the end, but, you know, and 50%, 56%, as you see on the slide, maintained either increase or decrease the job hours, et cetera. And so, again, I think as we move forward, you know, we need to continue on employment. We are an employment first state. We had the employment first work group. Many of you participate in the Supported Employment Leadership Network, the SCLN. Many of you deal with APSI. There's been a lot of discussion about certification for people who provide work and employment services. And so we will continue to move forward with that. Next slide. So we're getting into the final section here. And obviously, you want to focus on what do the opportunities look like. And you can see virtual learning right in the middle of the slide, basically. And, you know, again, that's what we've heard. You know, I really like the virtual. It gives me an opportunity to look at this and to gain my independence and not deal with a lot of other things. Next slide. So again, I think when you look at this, you can see that of the 130 who did respond to this, many individuals, again, learned new interests, new talents, new insights. And we start looking at this and saying, oh, this is pretty good. You know, 31% with the technology. Interesting. And then some people started exercising. Some people did independent living, a lot of art and creativity, and people did advocacy, etc. So these are the 5 largest categories that when we ask people what new talents and skills or technology, and these are the areas that basically came out as the 5 top areas. So again, we know it was 130, but you know, I think as a sample and taking a look at where we are, and you know, I think we can, at the risk of generalization, basically say technology is something that a lot of people are interested in and have been. Next slide. Okay, so since we talked about technology, then the question is, all right, what is technology? What do you do with it? And you can see on this slide, it's like I talk to my friends and family. Oh, I did doctor's visits. Must have been telemedicine. You know, participate in day program employment services. We talked about that earlier, where, you know, people would say, no, I'm at home with mom and dad. I'm not going to the day program. They don't want me to go. They want me to be safe, not exposed to COVID. I know we don't want anybody coming in, but it'd be kind of great if I had a laptop or some type of device where we could have engagement in some type of remote day services, et cetera. So we know that we've had all of this, and obviously even participating in religious services and volunteer work. So I think this is pretty telling about technology and where Maryland needs to be in moving forward with technology. And when I say technology, I'm talking about a lot of devices that can be used. Sometimes we talk about assistive technology, and we talk about somebody needs either a lift, or somebody needs a ramp, or somebody needs vehicle modification, etc. I think a lot of the technology that I'm hearing from people is basically around communication and interaction with the environment, other folks, etc. So again, we need to start moving forward with that a little bit more. Next slide. So this again is still on technology. We had a pretty good response at 4:35. You can see that where are we with 61% of over 430, and 39% would not use it. Would you like to use it? Yes. Would you like to use it? No. And then again, just looking at the numbers on the next slide, with supports, without supports, etc. And so I think that this has been really good and really interesting to show that we've got a number of people who say, I want supports. We get a number of technology, and a number of people who say, yeah, I want technology, but I may need some supports, or may not need any supports as we move forward with this. Next slide. So we know that we did a lot of virtual with the Appendix K. This is a breakout by age. We're getting short on time here. It's 1:58, so I want to be respectful of people's time. So again, these slides in this slide deck is made available, but you can see the percentages, and we looked at this by opportunities for technology, virtual supports. We did it by age, obviously. People who are obviously somewhat of an equal distribution, in my opinion, from with a plus or minus era from 18 to 64. And then obviously, where we are with people under 18 and the people over 65, et cetera. So, we've got this. I think it's telling. If you say that the average work life is up to 65 or thereabouts, or a little older, until people decide that they want to retire and do something different, then we can see that the assistive technology could play a significant role in all of this, either independently or with some type of support. Next slide. Here we are with looking at, where we are with some challenges with technology. And so we asked this question in the fall, as you can see, and we asked it again. And all of those areas that were identified in the survey, the percentages you can see of the fall versus the current, where the change was, I think it's showing that, we've made some headway with this. Need support to use in technology is not available, 40% down to 25%. And, again, like previous surveys, let's note that some of these respondents in the fall and in the current may not be the same. So we can't say that, this is 100% match, but again, knowing that technology overall looks like we're down 63%, where we didn't know how to use technology. So again, I think that we need to continue to do this and support people to be very independent through technology, etc. And I think that's our next frontier. I mean, we did, employment first. We are doing supporting families, and we need to do more with technology and assisting people. So how can the data support new opportunities? Obviously, with person-centered planning, we need to take a look and build on the interest and the talents that were developed during the public health emergency. We need to continue to look at where we are with our vaccination rate and continue to use telehealth and post-pandemic, not just during that period of time, since it'll be available. Okay, new opportunities moving forward. Employment, obviously we see new skills, interests that people want to do. We've got technology to leverage supports that are in our DDA waiver amendment 3, and then increased access and integration. Next slide. So let me give you a quick update of where we are as of June 24th, yesterday, and our numbers of people who tested positive, etc. So in the Central region, it's 894 confirmed positive, 1,307 negative, and 56 people have passed away. East region is 151 positive, 452 negative, 6 people have passed away. Southern region is 633 positive, 246 negative, 26 people have passed away. And in the West region, 371 positive, 42 negative, and 17 people have passed away. And now just go to our direct support that we usually talk about when we give up updates. So in the Southern region, it's 424 positive and 5 staff passed away. West is 212 positive and 2 staff passed away. East region is 236 positive and 1 person passed away. And in the Southern region, it's 711 and basically 2 people have passed away. Next slide. Here we are. No, back one. So obviously the chart on the right is what we've been reporting on, and you can see again we've had an increase of 4 in Central, 0 in East, 3 in South, and 2 in West region. And that's just and that's the numbers that we have by tracking people who have tested positive and the increases. So again, I think the vaccinations and the diligence of individuals rolling up their sleeves, the providers working with either the local health departments, the regional offices, and setting up clinics has been a proof that DDA as a unit, everybody who's part of DDA has been collaborating and working together. Next slide. Now you'll see that from April 29th until June 13th, that we have had 3 participants pass away during that 7-week period, and you can see the numbers that are on there of the, you can get us to 105 people who have passed away of the number of people who have tested positive of the 2154. Next slide. So here we are with self-directing, 38 positive and no deaths. And this is obviously broken out by the 3 regions and color-coded by data points in time. Next slide. So here we are at the number of people who are vaccinated, and we know that we've got a constant of about over 17,000 people. Again, we've got 76% have been vaccinated on this slide, and 21% have not been vaccinated, which is, we need to go back and take a look at that. There's been 134 clinics so far, and I'm a little concerned that we have not heard from some of the providers. Next slide is a tracking of family members, admin staff, etc. Again, these slides will be made available. Next slide. We have an FAQ on our website that you can take a look at regarding program services. Again, FAQs I think are extremely important. I mean, that's why we have them. It isn't like everybody's gonna, I know I don't remember everything all the time, so we need to go back and take a look at, so where's the reference and where is it? Where's the table of contents? What is it telling me? What is it saying? Especially with COVID and, you know, the Appendix K, and there were a lot of changes to the way we were doing business. So obviously, some of those will be going away, as Robert and Ron talked about earlier, with after the pandemic and where we are and getting back to what is a regular way of life. But obviously, it's not going to be the same as it was before the pandemic. And then the last slide basically is the upcoming webinars that we'll be doing in the dates, and obviously a click to go for the attendance, etc. And with that, we can take questions. I'd be happy to. We still have about 350 attendees. And so if there's any questions, and I know I'm over by a few minutes, I apologize for that. But, you know, I thought that there was a lot of useful information that people may want to listen to today and be able to go back and take a look at what's on our website, et cetera, and be able to look at the FAQs, et cetera.
Okay, great. So we do have a few questions here, Bernie. The first one is, after July 1, is the DDA suspected or positive staff person supported form still required?
I'm sorry, can you say that question again?
Sure. After July 1, is the DDA suspected or positive staff person support form still required?
I would say right now, yes, because you know, July 1's right around the corner. We should take a look at that. And we know that we have not had 100% reporting from either providers when we look at the total amount who have reported to us about people who are vaccinated or have not been vaccinated. So my answer is yes, we should continue that.
Okay, great. How many participants and or families received the reopening survey?
I really don't know that answer.
So what we'll be able to do is provide that answer.
We'll provide that. Yeah, we'll provide that when we post on the web. I know when we do mailings, we do mass mailings. You know, like when we do the National Core Indicators, when we were mailing out the forms and, you know, send it back paper link, and please recognize that it's anonymous, and, you know, we want to get your information and feedback, that we usually send out thousands.
Great.
But we'll get a number.
The next question, is there an exact end date for Appendix K?
I'm going to ask Rhonda Workman if she's on to talk about Appendix K, because she's the one who is our liaison to Medicaid. And obviously, Medicaid gets a lot of information from, you know, the Center for Medicare and Medicaid Services. Rhonda, are you on?
Yes, Bernie, I am. Thank you. In terms of Appendix K, the information and guidance we have at this point, as per approved on our Appendix K, is that it would end 6 months after the federal public health emergency. We are in close contact with our Medicaid office to be apprised of any updated information related to Maryland's plan. But at this point, our approval is through 6 months after the federal public health emergency.
Awesome. And then there's a point of clarification. So just to clarify, the mask mandate for healthcare, including group homes, is lifted for vaccinated individuals and staff, but all unvaccinated individuals should continue to wear face coverings indoors and outdoors when social distancing is not possible.
We will get a specific line answer from our Public Health Administration to clarify that.
Okay, great. And just looking through for more relevant questions.
How many more questions do we have in the chat?
I believe those are all of the relevant questions. There's some comments. And then I did want to add that the retainer day updates that Ron presented earlier are also noted in the guidance that Bernie shared, the FAQ. And so it's in the version that was revised on April 15th.
All right, so if we're at the end of the questions, we're like 11, 12 minutes over. Again, I want to thank everybody for being on the webinar, and we'll do this again, excuse me, next month. And I wish everybody a happy weekend and be safe. Thank you.